Okay, cool. We're on. Hey, welcome everybody. Welcome to ADR Support and group on Facebook, as well as Spine Circle. I've got four lovely people here with me. I've got Dr. Patrick Tropiano. I've got Caroline.
Delaurier. It's French.
I would never probably pronounce that. And then I have Craig Singletary, also known as CL. We're going to talk about some topics here today, which I think a lot of people are questioning on the group, and I think it'll be very helpful moving forward. I'm going to try to keep it short and sweet. One of the things I wanted to mention was Patrick is going to be doing some operating in Mexico City in 2023. Patrick, you want to kind of talk to us briefly about that?
Yeah, we try to start to do surgery in Mexico City in a very nice hospital, probably one of the best hospitals of Mexico City. And now we just try to check what are the conditions we can have, the safer condition for everybody, for the surgeon, for the patient, and just to start in 23.
I think it's a fantastic opportunity for a lot of Americans and even Canadians. It's obviously a much shorter flight for me in Houston. It's a 2.5-hour flight. It would be absolutely nothing. So Craig, CL, we'll get started with your journey. Do you want to kind of start from the very beginning, talk about your failed ADR that you had here in the United States, and talked about maybe how you were looking, and then you ended up in France and got a revision that's done very well for you?
Yeah, absolutely. Thank you for the introduction there, Jamie. So just kind of going back to, I guess, what was June of last year, I had my first cervical spine surgery. And at that time, I had two Mobi-C implants inserted, I believe at C4, C5, C5, C6. And at least one of the prosthesis was not, installed properly. And as a result of that, I had daily, almost persistent pain and burning pain and weakness in my traps. And it was unbearable, I mean, to be quite honest. And I was very, very fortunate to find a spine education support group, because obviously it was, through that community and through our connection, Jamie, that I was able to link up with Professor Tropiano, who, fixed my cervical spine and ended just unending pain in my neck and my traps. And, I'm so grateful and thankful, to you, Professor Tropiano, and to the group, because honestly, I really don't know where I'd be if I didn't have my revision by Professor Tropiano, who I credit for not only giving my life back, but saving my life.
Did you have any atrophy begin in your traps?
It's really hard for me to say, because my initial surgery was in June, my revision was in September. So I don't know if, there was enough time for atrophy to occur in a 3-month period, but I can say, post-op, I think starting maybe, 6 to 7 months, I was able to get back in the gym, and I'm in the gym now, 2 days a week, sometimes 3 when schedules allow. But as far as atrophy goes, I'm not aware of any atrophy.
Okay, yeah, I would agree. 3 months might be soon, but some people have immediate atrophy almost because the impingement is that bad. And then you were replaced with two Cp-Esps, correct?
That's correct. I went into surgery with Professor Tropiano with two Mobi-Cs, C4 through C6, and Professor Tropiano performed a 4-level surgery to include, revising the two Mobi-Cs to two Cp ESPs at those levels. So ended up with 4, and life is so much better now.
Any restrictions?
None that I could think of. None that I could think of. I'm back to many of my former hobbies, and just trying to, stay mobile, but no restrictions. I haven't played football in a little while, and maybe I shouldn't, but outside of that, I think I'm doing pretty well.
That's a fantastic story, and you're right. I remember our conversations earlier on, and kind of giving you some guidance, and you had a lot of great questions, and it's very good to hear that 4-level, obviously that's almost unheard of in most of the world, and Professor Tropiano does those quite frequently with huge success. I really appreciate you giving your story, Craig. It's fantastic. I'd like to move on to Sebastian. Sebastian obviously is in Canada. A little troublesome sometimes to find some good spine surgery up there. And one of the things that he mentioned, what he wanted to talk about was being prepared post-op as well as pre-op, and having that mental fortitude. When you describe it completely, is that, Sebastian, as mental fortitude through the entire process?
Yeah. So to me, that was the most challenging part. So physically, so I struggle with my back issues for 12 years almost. It's on the forum. People can look it up. And when I decided to go to France to see Professor Tropiano, for me, I had a surgery all lined up, same as Caroline. And because of the COVID hit here in Canada, it moved everything to the right. So to me, it was unacceptable. So
Sure.
it was good for me it was the right time for me. And what I mean by that is, and this I think is a personal decision that everybody needs to make, is when to take the surgery. For me, it was 12 years. All the surgeons that I told me said, wait for it. And I felt ready. And so I went, and I didn't feel a lot of stress going there or waiting for the surgery. To my surprise, and maybe Professor Tropiano will remember this, it's when I woke up from the surgery and I saw the first x-ray, and you see all that material in you, that is where it actually hit me. And I was confident before, and after that, I was really surprised of how stressed I was of the situation. So that's what I wanted to leave as a message. So you really need to think about this. And so I'm at 14 weeks post-op, and every time I had pain, and it wasn't a lot of pain. I think I was on Tylenol 5 after the surgery. And when I got here, I didn't take any medication, and I still don't take any medication. But every time you feel a nudge, a pull, or anything, my biggest challenge was that mental challenge, understanding that is the disc going to hold in place? Am I doing the right thing? Did I make a mistake here or there? Am I going to get better? So yeah, so for me, that is by far the greatest struggle in this operation. And I want to say that choosing your surgeon that's going to walk you through that is key. So Professor Tropiano, I saw in his face in Europe, when he saw me stressed out, he would send me get an x-ray, and I would walk back, and he'd look at the x-ray and he says, everything's fine. Don't worry about it. Don't worry about it. And here in Canada, I freaked out twice and I went to get x-rays. I would send it to him. I think it was 11 o'clock at night, his time, and he would respond to me in 15 minutes. Looks good, relax. So that was a key piece for me, and it still is. So I think that's got to be part of your thought process when you jump into something like this. I'll leave it to that right now, Jamie.
I think you hit it on the nail, is that you need to have a surgeon that's going to be there in your corner the entire time. And I think that's really what you prefaced on, and then going through the struggles, because it's a roller coaster. And I think every one of you can kind of admit that there's good days of recovery and there's bad days of recovery, and your body, just like when you pre-surgery, that you roll to the side and something happens while you're sleeping, right? And you get this pain. These all still can come about after surgery. Your body's still going to have mechanisms that it's going to cause inflammation afterwards. This isn't the endless, you're going to have pain gone forever. It's not that way, but it's getting rid of the symptoms prior to surgery that is really key, whether it's pain in the traps like Craig and what were your symptoms basically, Sebastian?
Before or after the surgery?
Before.
So for me, it was the instability. It wasn't really the pain. I wasn't taking a lot of medication, but because I tried to stay active as much as I could, I would rather go do my physical activities and then pay for it after. I don't know if that's right or wrong, but in any case, it wasn't so much the pain after. It was literally feeling my whole body tort because of the instability, and that would it would hurt my sleep. So for years, I would only sleep 2-3 hours a night, that's it. And then having to go back to work and all that stuff. So that's what killed me. And in the end, it really had a huge toll on my mental strength, my mental ability to deal with work day to day and all that stuff. So that was for me the greatest challenge physically.
Let me ask you this: how well are you sleeping now?
I'm sleeping a lot better. I still have hip issues, and you'll see me right down the front. I had that before when I had my accident. I had 2 torn discs, and there was a hip movement, hip injury as well. And that's why I waited so long, because they never really understood if my pain came from the hip or the back. But the point is it's a lot better. And I think it's because I've done something about it mainly. And the instability isn't there. I no longer feel the need to stretch ever, which I was doing constantly. I used to lay down on my back and just stretch it out. I no longer feel the need to do that ever.
Fantastic, fantastic. All right, Caroline, you ready?
I am.
Caroline has a little bit more of an in-depth situation in France, and she's going to be pretty candid about it all and talk about her journey and the mental aspect for her as well, because I know that it was a rough ride for you there for a little while, and we all commented on how young she looks today, and you know, she looks like a picture of health, and it's great to see that smile with all you guys, and so tell us about it, Caroline.
Yeah. So maybe I can start by just a quick history of my journey in France. So I'm from Canada, Quebec, and like you said earlier, Jamie, in Canada we don't have many options, and I was allergic to nickel, so I picked Professor Tropiano after researching for like a year and a half, and I was confident with my choice. Like Sebastian said earlier, I think it's really important to feel ready. And we all feel ready at different times. And I really felt ready. So I went for it. And so basically I got to France. I did a disc replacement at L5S1 with the LP-Esp. And although my situation looked very straightforward, simple, I had complications over there. So in the end, I ended up having 4 surgery, just 2 touching my spine, the 2 first ones, because I got my ADR, woke up with my left foot partially numb. And I'm so glad that I picked Professor Tropiano, because when you wake up from surgery and you can't feel part of your body, I swear to God, you panic really a lot. I was freaking out. And Professor Tropiano has been by my side multiple times a day, really checking up on me. He did tests really, really fast. So the same day I got a CT done, and there was, you know, perhaps a nerve root compression because the prosthesis had shifted. So what he did, he said, next morning, if you're not better, I go back in. And he told me I never did that in my whole career, to reopen somebody the next day. But if it needs to be done, I will. And that's what ended up happening. The numbness was climbing up my leg. And again, I think it's really important. I've told him that many times before I was in the hospital, and I thanked him, like, thank you for doing this, and for not, you know, just like closing your eyes. And many surgeons I've seen in their group say, no, everything's fine, where it's not. And there's a fine line between, you know, waking up with new pains, because that can be normal. You know, distraction pain creates a lot of different weird symptoms sometimes. But in my case, I had a clear indication of revision, and he didn't hesitate to do it, which was great. After the 2 final surgery, it had to do with my incision. It was well done, but I had a little rip in tissues because of severe constipation, and it's not really important to go into details. But again, these 2 were, you know, most surgeons would not have gone back in. Even in Canada, I was told by many, nobody would have touched you again. But Dr. Tropiano told me, look, you have a small tear, it might create a hernia in the future. If you want, I'll fix it. And I said, yes, please fix it. So my last 2 surgeries were that. And again, I really appreciated that he gave me the choice and discussed it with me, and we made that decision together. So like Sebastian said, choosing your surgeon is really important, and trusting that person, because I remember when I woke up with my numb left leg, I was panicking, and Professor Tropiano would give me information, talk to me about what's going on, what we're going to do. And I remember like freaking out and thinking, oh, maybe I should double check this with the group. Maybe I should blah, blah, blah. And then I thought, no, I picked him for a reason because I believe he's the best. And right now I need to be able to rest on his experience and trust him, and just not start panicking and ask a bunch of different people who don't even know really what's going on with me. So to be able to really trust that person, I think is really important. And I'm very, very happy I trusted him, and doing much better. It's still a struggle. I have a very difficult recovery compared to many. Unlike Sebastian, I'm on quite a lot of meds still, but I'm already much more functional than pre-op. And that's something I think is really important, to be ready psychologically before surgery, is to be aware that sometimes recovery can be quite smooth sailing for some, and it can be very, very difficult for others. And even if you have very successful surgery that's done perfectly, you might have a lot of struggle. You might not understand what's going on in your body. I still have symptoms where like sometimes I freak out, and I write to Professor Tropiano like, oh my God, what is this? And he reassures me, and it helps, a lot. So
I think you hit on a point that needs to be talked about a lot. And I don't know what your feeling is, Sebastian, on it, but a lot of people, they get surgery and 3 days later they're on the group. I think that is the worst mistake that you can do, is because you're looking for answers from people that really honestly can't give sufficient answers. There's so many people on here that love to give answers that it may not always be correct. I mean, Patrick Tropiano's got more credentialing and more papers written, and just the outstanding experience. And as you mentioned, not everyone goes perfect, and there may be a situation where you're going to need a revision. But Professor Tropiano, why did you the next day? Obviously, she taught you about her foot pain. Why did you go ahead and do a revision? What was your rationale behind that?
The rationale was she had the nerve compression with a motor deficit. That was not only a pain; it was something objective. And in this way, I will not able to let it like this. Even if I was scared, sometimes it's scary, to go back in this kind of surgery. And I never do that. I never had the experience to do a revision so quickly. It was my first time where the patient awake with a motor deficit in a lower limb. But you have to go there, and then there is no choice. Go back and
Gotcha.
try to fix your job. That's it.
Was a revision? Obviously, it was a much quicker surgery than the first surgery, right? You just went back in and moved the disc a little bit, or what did you actually do on the revision?
I changed the disc. I removed. I did the same approach. I removed the first disc, and I implant another one in another position.
And then Caroline, afterwards,
and I control the nerves. I control everything inside the canal, just to check that there was nothing coming from the disc or not impingement of the disc. Just I check everything to avoid to put every change in the good side of Miss Deloyer.
and Caroline, after the revision, did you notice a difference?
yes, like I'm not gonna lie, when I woke up from revision, I was in a lot of pain because I was distracted twice, 24 hours. But yeah, handling pain was difficult, but my symptoms of numbness subsided very, very quickly. The moment I woke up, I felt it was already a little better. And gradually over a week, I started to regain all my sensation. The motor deficit, I forgot to mention that, but I did have a motor deficit. That has gotten so much better as well, but it took longer. My nerves started to awaken again, so I started to feel pain instead of numbness, but that was a good sign, because nerves recuperating, it's painful. So even for people who had nerve compression pre-op for years, you might wake up from surgery and be in a lot of pain. Doesn't mean that there's an issue. It just means you're healing, and nerve healing, Professor Tropiano tells me so often, it's long, we need to be patient. But as weeks and months pass, like I think my motor deficit has been healed like 80%. So I have to be patient, but as long as I see slow steps of progress, sometimes I regress a little bit, but overall, I've seen progression since my revision for sure.
That's great. You know, you brought up something, and don't think it's embarrassing at all that you had constipation, and I've had a few surgeries, and I've had the same thing. You know, you get blocked up, and I think that's something everybody really needs to prepare for as well. It's something we're not really forthcoming on doing, but it's something that really needs to be addressed. And I know that Professor Tropiano has a lot of ways of giving you different supplements and things like that to kind of keep the process going. But it's really, you know, you need to get the fiber prior and after to kind of keep those things going. Because if you're not taking opioids and your body is not used to them, it creates havoc on your digestive system. And I think people really need to really think about that. And we all know there's surgeons out there that don't even mention that. Both of my surgeries was never ever mentioned, but I knew that from doing this for so many years that it can create havoc and create pain where you would ever expect it after surgery. You know, when you're in the restroom or bathroom, whatever you want to call it, and you're in there and it's a struggle, that's the worst because you already got abdominal pain. Would you agree with that, Sebastian? Did you have any problems with it, or were you pretty good?
It was a huge problem.
Yeah.
Huge problem. So I bought bags of dried prunes, and I broke a tooth eating dried prunes or whatever. And I ate so much of that. And it's you need to go with somebody that's comfortable with you because it's huge. It's a huge issue.
It is a huge issue, and people need to realize that as well. And I think that's what's great about the group is we should be able to talk about some of these things. And we get some crazy off the wall questions, and and I think the crazy questions I think are the sexual questions. You shouldn't be thinking about that for at least 90 days, but there's some people that that haven't. I'm kind of getting off topic, but this has been great. Dr. Tropiano, would you like to add anything with any of these three cases that you think that was left out or relevant at all?
Sorry?
I said, is there anything that these three cases you want to briefly talk about before we end this?
Those three cases with Miss Delaurier, Mr. Hebert, and Mr. Singletary, what they give to me, I would like them to first to thank them to come in Marseille and to trust in me because there is a huge decision for them to do this step. But each them is different experience in my department. With I don't know if who prefer the croissant and the pain au chocolat from the group.
That was a lifesaver because the first breakfast that I received was a hot water, and you had to throw a powder in it and two like buns that you could nail a nail with. And I was really, is that what we're gonna eat? And then Pastor Tropiano came in with chocolate croissant for me and my sister. So that was perfect. Yeah, that was a good times.
All right.
I definitely preferred the chocolate croissant.
Do you have those in Quebec? I know we don't have them in Texas, that's for sure.
We do, but the French ones are so much better. Oh my God.
I don't know what it's the freshness of it.
Yeah, I think the French do a lot of things better, especially in croissants. I mean, they're the ones that originated there, right? It's been great. I want to thank everybody. And I want to just mention, I picked these three people. I know Dr. Tropiano's had many patients come from all over the world to his place. The reason why I chose these three is because it's people that I talk to on a frequent basis. I've probably made great friendships with, and probably will talk to them for many years. And I'll probably be sharing my experience here down the road. I'm a 3-level candidate, and I've been pushing it off, and I'm getting closer and closer. And they've been a wealth of information for me as well. I just want to thank everybody. Remember, if you liked what you saw today, hit that subscribe button because we're going to have probably some more down the road as usual. You guys have a great day. Let me stop the recording.